You may not think of cancer as a lifelong disease, but that is the case for many people with certain slow-growing forms of cancer. One example is follicular lymphoma. It's a chronic but treatable type of blood cancer. Here to share more about chronic blood cancers is medical oncologist Dr. Alexey Danilov. Dr. Danilov, thanks so much for talking to us today.
Thank you so much for having me here today.
Very good. So how common are blood cancers, and what makes blood cancers unique?
Well, they are actually pretty common. About 1,200,000 people live with blood cancer in the United States, and someone gets diagnosed every 3 minutes. Unfortunately, someone dies from blood cancer every 9 or 10 minutes or so. So it is truly a problem.
But I understand that there are some treatable forms of blood cancer, and but there's also a type of blood cancer that isn't necessarily curable, but is treatable, which is called a chronic blood cancer. Can you tell us a little bit about that, and what is an example of a chronic blood cancer?
Yeah, absolutely. So in terms of blood cancers, yes, as you said, some of them are aggressive, such as acute leukemia. There are some aggressive lymphomas out there as well, and others are more slow-growing or so-called indolent. And examples of indolent blood cancers or lymphomas would be follicular lymphoma or chronic lymphocytic leukemia. So those two types are still very common. About 40,000-50,000 people get diagnosed with follicular lymphoma, CLL, other slow-growing blood cancers every year. So, what's unique about them is that we don't necessarily treat those cancers at the time of diagnosis. So what happens first is folks get diagnosed with those disorders, and then we evaluate for symptoms or any other signs, requiring treatment. And in fact, it might sometimes take 4, 5, 6 years, even longer, before patients with those lymphomas get treated. Another unique feature of those lymphomas is that we often don't use surgery to cure those diseases. So, we talk about lung cancer or colon cancer, how those can be cured with surgery. So not so much the case with indolent lymphomas. And that's because blood cells go into every part of a person's body, so we can't possibly take them all out. For those cancers, we use systemic therapies, what we call them.
Systemic therapies.
Yeah.
And are those like drugs usually, or what sort of treatment options are there for
That's right. So often we use drugs. There is also a potential for radiation sometimes, but often we use drugs. And typically we use a combination of chemotherapy or immunotherapy, antibody therapy. So examples there would be for chemotherapy drugs as bendamustine, cyclophosphamide. So those have been used for quite a long time. Examples of antibody therapy are drugs such as obinutuzumab or rituximab. Obinutuzumab was approved for therapy of follicular lymphoma in the past year. And certainly all those agents have their own safety concerns, and they are not necessarily for everybody. So it is really a very individualized treatment. And the right answer, of course, is to talk to your physician what's right for you there.
Right. Oh, of course, that makes sense. I'm just curious, what sort of symptoms do people with blood cancers usually present with?
So symptoms could be quite non-specific. Fatigue. Some folks present with fatigue, which develops over weeks to months. Others present with night sweats. weight loss. Those are the common symptoms, but unfortunately they don't necessarily tell us right away what's going on. Some people have low red blood cell counts, so-called anemia, which has its own set of symptoms, such as, again, fatigue, shortness of breath. Others can present with easy bruising. Often the way we diagnose those cancers, follicular lymphoma in particular, is people notice growth of lymph nodes in their body, and then we do a biopsy, and it takes quite a cohesive group of physicians, oncologists, and pathologists to diagnose those with certainty. So, but a variety of symptoms may develop.
Right. Oh, very good. Dr. Danilov, this is really great information. For people with blood cancer, such as follicular lymphoma, what sort of resources are available, and where can they find them?
Examples of good resources would be Lymphoma Research Foundation. So that's a great foundation which funds a lot of good research, very well respected entity in the United States. So they have recently redesigned their website. So great website with lots of good information. Leukemia and Lymphoma Society, same thing. They are not necessarily dedicated exclusively to lymphoma. They have a broader coverage, but those two are very good sources of information for patients with lymphoma.
Dr. Alexey Danilov, thank you so much for sharing with us today. Have a great day.
Thank you very much.